knowing Daniela. All right, Daniela, it's so wonderful to have you back with us again. You know, you whetted our appetite with the presentation of your examination project, your final evaluation in the advanced, and we just couldn't let go of you. And we welcome you tonight and looking forward to what you will present to us. A very fascinating theme. And so over to you.
Yeah, thank you very much, Taria. First of all, I have to apologize my poor English. Therefore, I made a presentation because it's a lot easier for you, not for me, but for you, if you can read everything that I want to say. So I will start my presentation. Okay, this is, let me see, this. Okay. So I'm in Germany on the other side of the world. I'm really glad that I have the opportunity to share what I am working with and what I'm doing and where I come from personally. So the course logotherapy is really, really great. It's a great thing to do, and I can really, if somebody, if anybody wants to learn to grow, this is a wonderful opportunity. So it does a lot to me. Um, First of all, I want you to know, please interrupt me if you have any questions, because I have so much to say, and I could really speak the whole evening, and I don't know if I'm through in 1 hour. So maybe we don't have time for questions in the end. If you have questions, just interrupt me. I won't look at you. I won't see if you raise your hand. So just speak. Um, First of all, I give you a brief overview over my family story and my story. So really, really brief. My father is born in 1932. He grew up during Second World War, and he grew up without his father. He had to, he had to work in the war. And my mother was born right after Second World War, and she was also really, really traumatized in early childhood and during pregnancy and of her mom. So in the womb, she was traumatized, and later again when she was born, even more. So the marriage of my parents was not really happy at all. They had good times, but they really had great problems. And I have one older sister, and she was like the black sheep of the family. My mother put all her hurt, all her pain on my sister, and she really mistreated her. And my mother committed suicide at the age of 57. This is a few years ago. And yeah, this is where I come from. I was the praised child, and my sister was the black sheep of the family. So I'm kind of in a good position, but what I grew up with, I saw a lot of bad things. So even though it's not that bad for me, but seeing bad things makes you. I was secondary traumatized. And because of this childhood, I became a rebellious and strong personality. I'm the kind of person you can compare with Robin Hood. So if anyone is in need or anyone needs justice or whatever, I'm there. This is. How easy will it be for us to ensure? Oh, I don't hear you. Can you speak louder? Was it for me?
Sorry, Daniela. I think it was just someone that didn't mute themselves, but you can continue.
Okay, thank you. But you can always unmute yourself and just ask or come in. That's okay. So about my story, I started working for German Telecom in 1990, managed a team and customer service, but I really missed meaning. And because I missed meaning, I started studying psychology. And then I became a therapist. First, I started counseling people, and then I became a trauma therapist because people who came, they were traumatized, and I really didn't know what to do. So I had to learn a lot in order to find out how I can help. And this is what I did. I wrote a book about violence and abuse in Christian circles. It's called Grasp the Inconceivable. I wrote this book because I just had to. I just had to because people came to me for counseling or for therapy, and I found out that really nice Christians have not only the Christian part of the life, but they have something like a day life and a night life. And they were not just Christians, but also Satanists in cult circles. And that was something that really, really, I mean, it turned my world upside down. And what I found out was something that I needed to share. I needed to write it down and share it with others because I never knew and I never was able to imagine that things like that really exist. And after that, in the end of 22, I founded an organization. It's called Isaiah Foundation. And it is to help victims of organized violence because people in this satanic cults or in this abusive cults, they are really, really heavily organized, and it's hard to help them and to get them out. So you see that I had to learn a lot of things because life asked me to do so, and I really, really want to help. I don't want to pass it by. When I see that there's something to do, then I need to find out how to help. So first of all, I don't see everybody, but I would like to find out how much knowledge do you have about trauma? And I had this idea to just let you give me an answer. If you say I'm a greenhorn, I don't know anything about trauma, then I would ask you to switch off your video now. And if you say, well, I have some knowledge about trauma, then please switch on your video so we can see you. And if you already have done therapy or support for those who are affected, then I would ask you to switch on, turn on your video and raise one hand. And if you really work with heavily traumatized people, then I would ask you to turn on the video and raise two hands. So that I see. I would like to look now. Just okay. I have two hands. Okay, Pan, of course. Sharia, of course. Yeah, but not all of you. Okay. Yeah, thank you very much. Not all of you are really skilled in trauma therapy or so. Okay, thank you. So it's good that I start with some basics to let you know. I will give you an insight about my work and also an insight about a trauma work to the basics. I prepared a definition to psychological trauma. So psychological trauma is something that overstretches our abilities. It's something that happens and we are not able to manage that. It's something that we see as it is a risk to our life. And when I say a risk to our life, then I don't mean the physical life. It can be the physical life, but it can also be our dignity or our values. And the third thing that comes to when it comes to trauma is that we have no chance to escape a situation. So it's overstretching our abilities. It's a risk for our life, no matter how we define it, yeah, and we can't escape. And when this comes together, then our brain activates an emergency mode. This is the normal reaction that we have to overwhelming stress. And when it all comes together, then we have an overwhelming stress. So let's look at the brain. I don't overstretch it now. When you look at the brain, normally something that you see comes in. It's like the entrance of a consciousness. It's the thalamus. When I see something, a snake or whatever, then I may be relaxed if I know this is not doing anything to me. But if I don't know if it's dangerous, then the amygdala, and this is, we have two sides, two halves of the brain, and we have two of them. The amygdala comes and does this emergency mode. So the short path in our brain is when the amygdala says, oh, there's danger. And when it comes to the short path, then we are not able to reflect on it. We are not able to think about what we can do now. We are just in this mode and we can't do anything against it. If things are not really dangerous, then we have the long path. The long path is also, it's coming in to the thalamus. It's passing the amygdala. The amygdala tells us if it's interesting for us or not. And then we store it. We store what the amygdala tells us to be interesting. We store it in the hippocampus. This is kind of very, very broken down to how our brain works. The emergency mode means that the prefrontal cortex, this is where we can think, this is where we have our personality. We don't have enough blood there because we need all our blood to fight. We need muscles, or we need it in our legs to run away, or we just freeze. So disturbing things like doing a math task or philosophy about Frankl or whatever is not possible when you are in the emergency mode. So this is a survival mechanism, and it's very good that we have it. But when it comes to trauma disorders, then it can be disturbing. So let me just go on. If you have questions, try to ask me. My English is not as good as I would like it to be, but I will try my best. So disturbing things are suppressed. Feelings can be disturbing when you are in an emergency mode and you just try to survive. Memories, cognitions, you don't need that to survive in that moment. The ability to think, this is, and sometimes when children are very small, when they are really little, then occasionally parts of the person can be split off. And this is what I work a lot with. I will skip this because we don't have the time for everything. Yeah, the nervous system is really interesting. Just very short, because the nervous system is like a day and a night mode. And when you are in a trauma situation, then you have the day mode, you have the active mode. And people who are heavily traumatized, they can't relax in a regular way because the trauma memories always pop up and they bring you in the day mode again and again and again. So they usually don't sleep well, or they have problems with the storm march or whatever. So what can you do? How can you help? If you see that someone is really suffering in emergency mode, and yes, of course, you bring them out of the situation if it's possible, and then you try to breathe really calmly and deeply, because people who are in the survival mode, they don't breathe relaxed. So if you want to bring them down, try to breathe with them and look how they breathe. You can orient your client in the here and now if it's not a situation that's happening now, if it's not acute, but it's a flashback. We speak of flashback when the trauma pops up again. The trauma from the past is not regularly filed in our brain. And this is why it can pop up in any situation. And when this happens, then the client is like in the trauma situation, even though it's done. I mean, it's in the past. The aim for trauma therapy is to integrate the experience into one's own biography. And of course, you have to somehow file away past experience, find closure and peace. This is the main aim of trauma therapy. So it's about the symptoms. It's not about meaning like in logotherapy. When it comes to logotherapy, then you have to be somehow careful, because in logotherapy, we don't look at the past. But if someone has a trauma disorder, then you need somehow to look at the past, bring it up in order to file it away, to integrate the experience. So the flashbacks won't stop if you don't do that. I tried to make clear what happens when trauma experience are not filed away. So when you remember the brain, the thalamus is the gateway to consciousness, and our amygdala, we have two of them, it's like the emotional filter. And when the amygdala says, this is an emergency mode, then all the memories are not filed in the hippocampus. We can't store them wherever they need to be stored. It's like a break, and they come down and they are unfiltered. It's called dream memory. I prefer to say trauma memory, because you can't directly access it. What the hippocampus stores is our regular memory about our family, about our work, or whatever, and we can recall that. So we can remember that. We can just decide to remember that. But we cannot decide to remember trauma if it's not regularly stored. So the trauma is very powerful in someone's life. Okay. If the brain hasn't processed the experiences, you can't come to terms with the matter. This is what I just explained. And by the way, what's really, really interesting, what I found out, and it's not really new, trauma memories are not linked to the narrative memories, and that means that you are not able to learn out of trauma experience. You may know somebody, for example, a woman who has a bad husband who beats her, who's violent, and she really can tell you everything that he does, but she can't realize that he's not stopping doing this, or she has the next husband or the next man, and it's the same type of man, and he's again beating her, and she cannot bring together that these men or these kind of men are beating her. She knows what happens, but she always thinks it won't happen again. So there's a missing link in her brain. And this missing link is because her trauma memories are not connected. So she can't learn out of it. She's not stupid. She's just not connected with realizing what it really means. Yeah, the consequences of trauma, I have to look at the time. Okay, that's okay. Can cause various symptoms and diagnoses. I work with dissociative disorders. This is, you can imagine if you stand beside yourself, you're not really experiencing the I. You look in the mirror and you ask, oh, who's that? Not only in the morning, but in different situations. You have the experience of alienation, and this is typical for dissociative disorders. Dissociative identity disorder is when we speak of multiple personalities. This is when different personalities take over the body, and it can happen that you speak to someone who's 20 years old, and the next moment you speak to someone who's 5 years old in the same body. And they may know each other, but often they don't know each other. This is typical for multiple personality. Dissociative identity disorder is how we call it now. In the past, we called it multiple personalities. And of course, post-traumatic stress disorder. This is when you have all these flashbacks, these nightmares, states of anxiety, avoidance of different situations that might be, harming you. But there are also symptomatic overlaps with other diagnoses. When you have a dissociative disorder, then the dissociative disorder is often overseen. And it sometimes looks like schizophrenia, it looks like a bipolar disorder. My first patient was a girl with an eating disorder. And when you have someone with eating disorder or panic attacks, you don't think of a dissociative disorder. But it can come all together. So people who have symptoms of autism, panic attacks, or whatever are often overseen as a dissociative disorders. DID, I just explained DID. There's a dissociative disorder not otherwise specified. This is very close to DID. It's not that strong. When does it happen? People who split off personality parts or build personality parts, a second personality, a third personality, sometimes it can be really hundreds of personalities. It happens when they are tortured before the age of 5 or 6. Because when children are this young and they are really abused and tortured, then they don't have a clear I. They don't define who am I. So before the I is really defined, it is easy to split off personality, because when they are tortured, they go out of the body and somebody has to stay in. So they create a new personality who takes over until it's too much, and then the next personality is created. So these people are what I work with, and I decide between accidental DIDs and programmed DIDs. So children who survive a war, abuse, extreme neglect, whatever, by a primary caregiver, can split off personalities, but it's not intentionally made. I work mainly with programmed DIDs. They come from satanic cults, or they have, there are reports of secret services who do it not only in the US, in many countries. satanic groups like Illuminatis, or just human trafficking groups, or sexual abuse circles, whatever. So they do it intentionally because they know when they create different personalities in one human being, then they can call out personality who does like sexual services, or another personality who's doing whatever they want. I don't want to go into detail now. I can see this. Okay. Working with ego states is something that really helps these people. And I invite you to do an exercise now if you like. So you can do the exercise meeting the inner me. And I invite you now to relax and remember a good and very emotional memory and experience, maybe last week or whatever. It can be in your childhood if you want. And then once you've got this memory, you can recall the feeling about it. Just think about it, how it felt to have this good experience. And when you remember the feeling, then I want you to go into this feeling. Going into this feeling is like, I call it using the fact bridge. When you go into this feeling, you can go your past, you can walk down your past, better to say it this way, and try to find the first time where you had this feeling in life. Maybe you see a picture now if you do that. If you see the picture and you know the feeling, then you can just go there as an adult. Today you are an adult and you can go there even and just watch it. The next step would be to meet your former self. You can use imagination and just go to your former self and listen to it. What is she or what is he saying? And then you can start a conversation and explain who you are. You come from 2025, you are this old, and you just wanted to say hello. Okay. Now you can tell your former self that you are in a session right now and you have to come back. But if you like, you can visit your former self again after this session and just have a good conversation and have a good time together. So I ask you to come back now. I do this exercise with traumatized people because they often have parts of the personality or even whole personalities split off. And when they go back to to a part of the personality, and then they can find out things about what happened, and they come to they are in the position where they can do something. It's not the therapist working, it's the person affected is working, and they can do a lot of things. Imagination is a powerful tool. They can use it to take care of a little child who is abused or is abandoned, and they can bring them food, they can bring them whatever, clothes. They can just show love. Maybe the former you didn't have enough love. So what the adult can do is go there with imagination and give the former self really some comfort. When a patient is doing this, then they come to the point where they are responsible. And they can take responsibility because they are able to act. It's not that the trauma acts with them, but they can act against the trauma and against the symptoms. So this is something that I wanted to share with you. This is a brief overview. Getting in touch with the inner me is what DID clients really need to learn, because they have a lot of a whole world. They have a whole world inside. So if you look at the visible area in this chart, this is the everyday people. This is the person who comes to get counseling. And behind this person, when you speak with the everyday person, then you have to know that all these people, that all the inner world is able to listen to it. So you're not only speaking to one personality. There are guidance, there are punishers, other victims or functions, reporters, internal programmers. This is what cults really, really like to do. And cult loyal personalities. They don't know better. It's not that they are bad. They just don't know better. They are made that way, and they don't know that what they do may not be really, really good for the person. So when you speak to the everyday person, and you don't know that this is a dissociative DID, a man-made DID, then you may not see what's going on. But when you know that they are in a cult, then you can know that there's a lot behind, and you can try to talk to them. Even though you don't see them, you just see the everyday person. So when I work with clients, rules are very, very important to me. And I give the rules to my clients, and the first thing I tell them is that a patient remains stressed. Why do I say that? And sometimes they look at me, the everyday person looks at me, why do you say that? Of course I stay dressed, yeah. And I say this, I say it because little ones inside, maybe they've been abused, and they've been, yeah, they needed to work for sexual trafficking and things like that. And they wait for the moment until I say, get undressed and do whatever I want. So this is why I say I have rules, and my patient always remains dressed. I say that because I know that in the back somebody is listening to it, and they need to know that. I say that mistakes are always allowed. Very, very important, because people I work with, they always receive punishment. So I make a difference, and I say punishments are not allowed in my therapy. We have to check how we deal with appointments and things like that. But most important is that I respect the free will. And when I say that I respect the free will, I don't only respect the free will of the everyday person. I also respect the free will of the inner persons. And I want the everyday person to respect that too. So this is really, it's different to work with people from cults, from programming, than with regular trauma clients. So I will skip this due to time. It's late now. Yeah. I said trauma therapy is body, psyche, and spirit. So I want to reflect on that a little bit. The body is the crime scene. Through the body, the trauma happened, and trauma parts may have been created. So through the body, they can also be reorientated. So when they are created, then you can use the body to dissolve programs. Experience of the body are more impressive than just imagination. We just did an exercise for imagination, ego state work, and this is for our brain as interesting as experiences that really happen in real life. Our brain doesn't make a difference. So experience is experience. If it's just imagination, it doesn't care. But when we experience something with our body, then it's a deeper experience. Body work may arise spontaneously. You may have a flashback or something like that. You can use it to work with it. If you're not alone, if you yourself have a flashback, then it's really, really difficult. You cannot use it. You can work after it's gone. But if it happens with a client and you see that, then you can interact and you can use it for good. You can take orientation via the body as an opportunity. And when I say it's an opportunity, then I mean you don't have to fear it. It has meaning when it happens. Programs can be dissolved. A program is something that, for example, a cult group or a criminal group wanted to have. They wanted to have a special behavior in one person. So you can dissolve that. When you bring the person out, when the person is allowed to come out, you can orient this person in the here and now. If this person has something that needs to be solved, then you can solve it now, here in the body. Even so, if the person is 5 years old and the body may be 50 years old, it doesn't matter. It's very important not to touch the client except with clear permission, because touching can bring out flashbacks. So we don't want to do that. We always are very, very respectful with clients like that. And if you work with EMDR, I don't know if any one of you does it, but you have to be careful with programmed DIDs, because this can really crash an inner system. The inner world can be crashed with that. Do I have time? Yes, I have enough time. I have an example for eating disorder of a DID patient. I don't know if you really want to hear that. So if you don't want to hear that, you can do something else the next 2 minutes. For example, people in satanic cults or in cults, abusive cults, they are really conditioned. And they have personality parts who had to eat really bad things. And this is a traumatic situation that the cult creates. They want to gain power about eating behavior, and therefore they create parts who don't want to eat, and they had to eat, for example, poo or something like that. And this is a traumatic situation. When an inner part who has experienced something like that comes out in the body, then they still have the feeling of, for example, poo in the mouth. And when he or she comes in the body, and you can wash the mouth out, and you can give some good food, and you can breathe deeply and do something really nice, then the program can be resolved. So this is how we work with the body when it's possible to do that. So, but the main work when you have to do with the trauma experiences is really in the psyche. I define psyche as mind, will, and emotion. I know that there's some overlapping with the noetic dimension on the mind, but I put the mind in the psyche. It's easier for me to do it this way right now. Feelings and symptoms can lead to inner personality parts and memories. So we always work with what we have, as Reverend Lee Brown said this. He was leading a gospel choir, completely out of context, but he's right when he says we always work with what we have. So with VID clients, we can do inner work with imagination. This is ego state work, what you exercised a few minutes ago. We can do some externalizing, like telling them to paint pictures. We can use a family board and put it all together and make it visible what's going on inside. We can care for suffering inner parts, wash and clothe them. This is more imagination, or when they come out, we work with the body. But oh, this is still body, I see. No, okay. But what is really, really important is that we bring out the truth. Because people who are heavily traumatized like that always believe in some lies. Lies like, you are a bad girl, you wanted to do that, nobody loves you, and things like that. And we have to work with that. And this is on the psyche level. I use the Socratic dialogue in a different way than we learned it here at the logotherapy course. I don't use it to find logo hints. I use it to scatter, to really shatter beliefs and see what's left when everything is shattered, because the lies will fall down and the truth will remain when you do it like this. So truth is very, very important for people who are traumatized, because they are traumatized and they are made to believe a lot of bullshit. Okay, this is an example for the Socratic dialogue that shakes yeah, what people believe, but I want to skip this. You can have the files, the file that I have here, if you like, so you can look at this later. Yeah, most interesting for us in logotherapy, healing through meaning. So where comes logotherapy in? I do believe that logotherapy itself doesn't have enough tools to help traumatized people. But logotherapy, Viktor Frankl never meant logotherapy to stand alone. he wanted logotherapy to be integrated in other therapies and in all the work we do with people. So this is maybe another translation than what you are used to. Frankl stated, it is absolutely never important what we expect from life, much more only what life expects from us. So when you say this to a traumatized person, then you really turn the world upside down. Traumatized people are often really fixed and somehow captured in their sickness, in their symptoms. And when you turn it around and say, life expects something from you, this is disturbing. And this is a very healthy, disturbing thing to do, because they come to the point where they are responsible for the answer that they give. So telling a traumatized people, you're not only a victim, you are a person who is called to give an answer. This brings them in a position where they can act. When people are traumatized, do you remember the definition of trauma that I gave you in the beginning? They are all overwhelmed, they can't react, they cannot do anything. But telling them to give an answer is something really powerful. So the focus is not on the bad things that happened. The focus now comes to, what am I doing out of this? What is my answer? And having this focus, is really, really healthy, because I wrote here, once the question of meaning has been clarified, patients can walk on water just like Peter looking at Jesus. You may know the story in the Bible where Peter gets out of the boat and he's walking on water. He's walking on the water as long as he looks at Jesus. And this is similar to trauma therapy when you add logotherapy to it. When traumatized people look at the answer, at the meaning of their experiences, it's like looking at Jesus, and they can walk on the water. Walking on the water means there are waves and it's really, really sometimes rough, but they can do it as long as they look at the meaning. When they look at the water, when they look at the trauma, at the waves, they just sink down. I have had many clients who didn't want to do trauma therapy because they were not tough enough to face it, to face what happened. So when you give them meaning, and when you tell them that they not just look at the trauma, but the big aim is to give an answer, then they can look at it. It's a lot easier. Okay, I will skip this and give you some time for questions. Oh, I have made this one, and this is maybe not perfect. Charia, you can tell me if this is good or not, but this is the noetic dimension, the way I understand it. It's when you say that I am spirit, then you say I am healthy. I am the one who works on my psyche, and I am the one who works on my body. And I find meaning in my circumstances. So the noetic dimension is here, the yellow part. And psyche and body is, there's a lot of interaction between psyche and body. Mind, will, and emotion. Okay, mind is part of the spirit too. There's some overlapping, but mind, will, and emotion is what I can work on. And when you look at yourself like this, or when you look at your client like this, then it's a lot easier to do trauma therapy. So I end with my last chart for today, and this is further research what I'm going to do in the future. What's really interesting to me, and maybe one or another of you has some ideas about it. What I work with are victims of criminal groups like satanic cults and something like that. It's bad enough. But what clients tell me that they work with the help of demons, and they come into the spiritual realm and work with demons. I know that 90% of what they call demons are not real demons. But I do believe that the spiritual realm has an influence. The victims are tricked into letting demons help them through traumatic situations that are created by the cult. And this sometimes has a lasting effect on their lives. I didn't know what to think about that when they told me things like this. But unbelieving programmers in cult, they also practice it, and they say it works. And it's not just working because the child they program believes in it. So I experienced in trauma therapy with Christian patients, because I'm a Christian myself, and sometimes I have Christian clients that I can pray with. And I just found out that simple prayers are very helpful, or bringing them into the into the God heavenly realm and experience Jesus, experience the help of God. This is really working, and I think it's more than imagination. So what I would like to find out is a little more about the question, does the spiritual world influence our psyche? I'm not sure if the spiritual world is influencing our spirit. Yes, of course it does. But I really don't know, when people are split off, if the spiritual world is able to influence our psyche without our spirit. If you say that the spirit is the healthy part of the person, then it should not be possible to influence the psyche. But somehow I see that, and I don't know how it fits together. So can trauma block or split not only the psyche, but also our spirit? This is a very good question that is really an open question. I don't know if it's possible. And I wonder how much influence our decisions, our free will have. I do believe, and yes, I do know that our free will has really big influence. But I don't know how far it goes. So these are questions that I still have. And now, if you like, I have to give you something light now. And we have a few minutes left. If you have questions, then this is a good time to share. So let's end with a joke.
Daniela, I just want to immediately say, since we have so little time, that this is the power of logotherapy, that we do not work from, in a sense, from the inside out. But in what I mean by that, typically in other therapies, they start with the trauma, and they kind of work their way up towards, encouraging coping skills and getting a better sense of self, etc. Logotherapy starts with exactly what you said. The breakthrough in how you find the person in the trauma and your look and your whole demeanor and what you say to evoke that person to come to life out of the trauma. Then it's like when there is a sense of a connectedness with self through the fact that you saw the self and you connected with the person behind the trauma, then your trauma therapy takes on much greater meaning, because then you can go back into that past, into the experience of the trauma, but with a different orientation. In other words, we don't work from a victimized state to a state of arising out of victimization.
Yeah.
We start as logotherapists, we start with the truth of being, even though the client doesn't feel it at the moment, but the more we focus on that and we find the client again and again in the good experiences, or just the good experience that they're having with you, then what you're looking at becomes something, instead of your being dissociated from the what happened to you and all the pathology that then develops, you are at the self-transcending distance of evaluating what happens. You are in control in looking at what happened to you, and that makes all the difference. You start with a state of victory. Your faith in the client is immediate and strong and passionate. And from that breakthrough, everything else takes on a totally different meaning. Then trauma is something that happened to me from the outside. I wasn't a victim to be born with. I wasn't born a victim. In fact, I was born with this ability of who I am. And that gives me such power in looking at the trauma in ways that then I have the mastery of control, and of evaluation and decision and free will, and moving out of it and doing something effective with it, and even turning then the adversity into a triumph. I hope you understand what I mean.
Yes, I do.
Yes,
I
I
really
think you
do.
do. Yes,
And this was the missing point at trauma therapy. This logotherapy part was really the missing point.
yes. Yes, that's right. And that we actually, we don't realize that in your kind of that if you're traumatized with your client, and you think you've got to handle the trauma and you've got to help the client out of the trauma, what are you actually doing? You destabilizing them. You actually affirming their victimhood. But
Yeah.
if you have a stand of, this is not you, what all the false thoughts and the fears that you built up about yourself, that's not you. And so you start from, in logotherapy, from that victorious point of who I am, fundamentally is the person who I can bring out and bring into a position of the person that I can be and ought to be. And it has a powerful and very different effect. And I just wanted to say, when you said that, in ordinarily, in most logotherapists' mind, they seem to say that we're not dealing with the past. But we have moved into a very powerful position of going into that past but with a look of meaning.
Yeah.
And that is, I found that works so very powerfully. It's not just working on the noetic dimension alone. We start there, but then go right back and rescue ourselves from that
Mhm.
past. Yeah,
Yeah. Genau. Very good. Thank you, Taria. Thank you very
yeah.
much.
Daniela. Ah. Well, as Grant said, he left. I'm sure we've gained such a lot of from you, every one of us. I've made copious notes over here. You have stimulated very many of my thoughts and gave me new insights as well. So thank you so much for that, Daniela. You're doing a most terrific work, and I think the greatest example of what I said the victory of logotherapy is you. With your traumatized past, you were born in trauma.
Mm.
You were born in a traumatic situation. Trauma surrounded you from birth.
Yeah.
And look where you are now. You're dealing with that trauma in
Mhm.
a masterful way, in a way that rescue and saves the person and helps them to walk on the water instead of drowning in it, because
Mm.
you are that kind of role model. That's what's making you so powerful. Looking at Jesus, it's a role model.
Yeah.
It's a statement of who we can be if we have the right attitude and do not think of ourselves as drowning, but as able to get above the waters and walk on it triumphantly. That's it, being masterfully ourselves.
Yeah.
Wonderful.
Yeah. Thank you. Thank you very much. So, is
Okay,
anybody
everybody.
else here?
Unfortunately, the time is up, and as you said, we can go on and on about this, but I encourage every one of you, if you have questions from Daniela, email her, get into conversation with her, okay?
Yeah.
I think it was such a tremendously interesting presentation that I want to suggest perhaps we can have another meeting of discussing this, and then we can ask questions and have a discussion about this presentation, because it is really, really most interesting the way you
Yeah.
presented it. And if I got you right, you presented it in a way that both logotherapy was the missing part in trauma therapy, but also in logotherapy, trauma therapy was the missing part. Did I understand you correctly?
Yeah. Somehow you're right. Yes.
So I
That's
think
right. Yeah,
it's
you're right.
incredibly interesting, and I actually have a little question, but I think we are a little bit over time, and
Yeah.
maybe we can have another session with
Yes,
discussion about it.
I think that's a very good suggestion. And in the meantime, we can accumulate our questions and our thoughts, and we'll make another opportunity, Daniela, if you are prepared for us to have another chat with you.
Of course, we can do that. Mhm.
Okay, we'll do that.
And in the
Right.
meantime, we will get the presentation, or it would be on the site, or what?
You can have it. I can send it to Pam. I don't. Yeah.
So
Yeah.
it would
Yeah,
be on
that's a
the
good
site,
idea.
Pam?
Mhm.
Okay, I unfortunately do have to go.
Yeah.
So I say good night to everybody. Daniela will follow up, okay?
Yeah. Thank you very
Hungry
much.
husband,
Okay.
hungry husband.